What's going on, y'all? It's Damian Washington here with MS Views and News, MS Views Now. I have Dr. Aaron Boster of the Boster Center for Multiple Sclerosis in Ohio.
Howdy, howdy. Damian, thank you very much for including me today. My name is Aaron Boster, and as always, thank you for learning about MS with me. I want to thank MS Views and News for the opportunity to raise our level of understanding, to help educate, energize, and empower people impacted by MS. It's a time right now when a lot of people are scared. It's a time right now when we need good, solid information. We need to remind ourselves that we are a global online community here supporting one another. And I'm looking forward to the next couple minutes when we can break down what's going on with COVID-19, this novel coronavirus, and what active things you and I can do to stay healthy and keep our community safe. So let's dig into that conversation, and I appreciate this opportunity.
We're going to talk about Corona-19 and multiple sclerosis, and we're going to have that conversation right now.
So if we break it down, let's talk about viruses. When we think about the flu, what we're actually talking about is influenza. And influenza A is a virus that impacts the whole world during the winter months. It can be quite serious. It takes lives every year. And when you talk about getting a flu shot or a flu vaccine, you're typically talking about taking strains of last year's influenza virus. But influenza is not the only kind of virus that can give us a cold. In fact, there's an entire other family of viruses called the coronavirus family. And the coronavirus family is made up of hundreds and hundreds of coronaviruses. These are largely RNA viruses. Some of the viruses impact humans and can cause us to feel sniffly and yucky and febrile, etc. Other types of coronaviruses don't affect humans, they only infect animals. And so there are animal-specific coronaviruses. Now, what's unfortunately happened in the world today is that one of these animal coronaviruses, and we believe it's a coronavirus from a bat, jumped species and figured out a way to infect human beings. And our bodies, our immune systems evolutionarily are not used to this novel coronavirus, and it's causing quite a pandemic across the world right now. So we've coined novel coronavirus 19. It's a new coronavirus that we're not used to seeing.
So essentially, we all have a bat cold right now? Is that what it is?
Kind of, in a weird way. The idea is that a coronavirus that really only infected bats jumped species and now is infecting humans. We first saw this several months back in Wuhan, China, and it has now spread and become a global pandemic. And it's got a lot of people very appropriately concerned. So what I would like to do is kind of talk a little bit about what the virus is, the way it presents, and then get into risk factors to increase the risk of catching the virus, increase the risk of having a severe infection if you have the virus, and most importantly, what we can do to fight back to protect ourselves. So Let's have that conversation.
Let's just go into it. Talk to me about how I can prevent myself from catching the bat cold.
There you go. There you go. So first, some knowledge about what novel coronavirus is, what COVID-19 is, how it presents. And so what we're seeing, the most common symptoms of people that catch coronavirus is fever, cough, and shortness of breath, just like most other viruses. And in fact, 80% of people who contract coronavirus, they're going to present with a mild cold. It's not going to necessarily feel any different than any other cold, and they're going to clear it. Typically, there's an incubation period, a delay between 2 and 14 days from when you contract the virus to when you manifest symptoms. And it's important to note that even when you're asymptomatic, meaning I've come in contact with a virus, I now have the virus, but I don't even know it yet, I'm not manifesting symptoms, I'm not febrile, I'm not coughing, I'm not short of breath, I can still pass the virus on during that incubation period. And so that's an important thing that we need to keep in mind. This virus is not spread, we don't believe, by respiratory droplets, like it spews in the air, as much as viral particles being coughed out or sneezed out and then adhering to surfaces. And then we touch those surfaces with our hands, and then we touch our face, and we get ourselves infected that way. And that's actually very relevant as we game out how we're going to prevent ourselves from coming in contact with this virus. Now, I mentioned that about 80% of people that are impacted have a mild cold and then they clear it. About 15% of people are going to have a more serious condition and they're probably going to need medical assistance. And somewhere around 5% of folks are going to need intensive care. Now, the mortality of this virus is higher than that of what we're familiar with influenza. And that's obviously very, very serious. And we've identified certain risk factors which predispose a given human to have a risk of more serious infection. So it has nothing to do with whether or not you could catch the virus, but if you catch the virus, certain risk factors make that a more serious infection for you. And so what are those things? Number one, age. So being under 9 years of age or being over 60 is an independent risk factor for more severe disease. That doesn't mean if you're 62, woe is me, doomsday. It simply means that you're in a higher category of risk. And each decade that you go up past 60, the risk seems to skyrocket. So 70-year-olds are going to be at increased risk compared to 60-year-olds, and 80-year-olds, the mortality associated is actually quite higher. And so that's one factor, is age. The second factor is comorbid conditions. So if you have a heart condition, a lung condition, if you have a diabetes, if you are immunocompromised from a cancer, or if you have low white blood cells from a therapy, and we're going to be talking about some of those, this would increase a given individual's risk not to catch the virus, but if they catch the virus, to have a more severe form of the infection. Another factor that I think that we must consider is geography. So right now, we're having a conversation. I'm in sunny Columbus, Ohio. You're out in Southern California. And these are very different parts of the United States with different degrees of concern geographically. We have not seen as much coronavirus in the Midwest as we have on the coasts, for example. And if we were having this conversation in Italy or in Japan or in Korea or in China, we would have very different recommendations than we would if we're talking in LA or in Ohio. And so I also want us to keep in mind geography as an important factor. Another factor that I think we have to keep in mind is occupation and vocation. If you are a stewardess on an airplane flying around, or if you are working in a hospital and coming in contact with a lot of people that are ill, your risk profile may be a bit higher than if you work on your computer in your basement. And so that's another factor that I think that we have to keep in mind. Now, I want to jump in specifically and talk a bit about MS. You and I are both members of this larger MS community, and there's a lot of concern. In fact, in the popular press, I'm getting a little bit frustrated with the message, don't worry, it's only a problem for the elderly and the ill, which frankly is rather disrespectful.
I'm not elderly, but I'm ill.
Well,
That's everyone else who's watching this. They might be elderly, and they might be elderly and they're ill, but they're certainly ill.
And so, what we need to do is we need to put that aside and we need to ask ourselves instead, what can we do to help our communities? Because every single person listening to this can play a very active role in helping the community not contract coronavirus. We're going to list active things that you need to be doing, that I need to be doing to help each other out. So let's talk about that for a second after I have a sip of coffee.
Oh, you got your awesome juice, and so do I.
So let's talk a little bit about multiple sclerosis and this COVID-19. Having multiple sclerosis in and of itself is not a risk factor for contracting COVID-19. Having MS by itself is not a risk factor for having a more severe infection if you contract COVID-19. With the caveat, Damian, that if you have advanced multiple sclerosis and you're seriously affected where you can't take deep breaths, you can't cough adequately, you're not able to move, that would place you at increased risk of severe infection. So I do want to throw out that caveat.
Okay.
Now, whereas MS in and of itself doesn't increase the risk to contract COVID-19, and it doesn't increase the risk of having severe disease, some, not all, some of the MS medicines that we give people to combat the disease, I'm talking about the disease-modifying therapies, can increase the risk because they suppress the immune response. And so I kind of want to walk through with you the different MS medicines with the lenses of, does it increase or decrease the risk of a severe infection for COVID-19? So let's
Please
jump
do,
through that.
because some of us are on Copaxone, some of us are on Lemtrada. I'm
Exactly.
on Ocrevus.
Exactly.
There are a range of various medications that have different mechanisms within the body to combat the multiple sclerosis either attacks or relapses as well. So
that is
these
exactly
are
right.
all very concerning because everyone is on a host of different medicines, at least like 16 different medicines, something like that.
That's exactly right. So let's break it down at a relatively high level. Number one, if you're taking an injection, right? So if you're taking an interferon beta product like Plegridy, Avonex, Betaseron, Extavia, Rebif, or a Copaxone injection, we do not consider you to be at significant increased risk. Those medicines do not suppress the immune response. They don't lower the white blood cell count. They work by modulating the immune response. And if you're a person with MS and you're taking an injection, I do not think that that injection increases the risk to have severe infection if you come in contact with COVID-19.
Well, thank you, immunomodulators. Thank you.
Yeah. Now, if we to talk about pills, all pills are not made equally. There's a bunch of pills on the market and they all work differently. Aubagio, which is the trade name for teriflunomide, is a once-a-day pill for MS. It also does not lower the white count significantly. It works by what a doctor term cytostatic. So it makes cells play the freeze game, but it doesn't murder them. And we don't feel that putting someone on teriflunomide Aubagio would increase the risk to fight the infection. Now, as a sidebar caveat, the doctor nerd in me, I think it's fascinating that teriflunomide actually has antiviral properties. And so hypothetically, there may actually be a benefit, but that's conjecture. We don't actually know that. I just think that's like kind of interesting. The punchline here is, just like with the shots, if you're taking Aubagio, I'm not terribly worried about your ability to fight the infection. Now, I can't say that those are the rules for all of the pills. The next pills I like to talk about are the fumaric esters. So this is Tecfidera, yep, and Vumerity. So Tecfidera, which is dimethyl fumarate, and Vumerity, which is thyroxymal fumarate, are both pills that you take twice a day for MS, and they are not supposed to work by suppressing the white blood cells. That's not how they're supposed to work. In about 15 to maybe 20% of patients that take Tecfidera Vumerity, there's a side effect where it lowers their white blood cell count. And if the person with MS on Tecfidera Vumerity has a lowered white count as a side effect, then they might be at increased risk of a severe infection if they were to contract COVID-19. So how do you know if you with MS taking Tecfidera are at risk? You got to holler at your doctor, because they're going to have your laboratories and they're going to be able to look at your white blood cell count and your absolute lymphocyte count, or your ALC. And the absolute lymphocyte count is the subset of the white blood cells that we're really focused on. Ideally, we want that number to be above 0.8. So if you're taking Tecfidera and your absolute lymphocyte count is above 0.8, I'm not very concerned about your ability to fight off COVID-19. If, however, you're on Tecfidera and your absolute lymphocyte count is below 0.8, then I think that you might be in a slight increased category of risk. And so with Tecfidera and Vumerity, there's a level of granularity that we have to get into. We have to look at your labs to be able to adequately counsel about what to do or what not to do. Now, the next pill I want to talk about, or two pills that I want to talk about, are the S1P1 receptor modulators. That's a mouthful. We're talking about, we're talking about Gilenya and we're talking about Mayzent. So those are trade names for fingolimod and siponimod. And
we're talking about Mayzent and who again?
Gilenya.
Mayzent and Gilenya. Got it.
Yeah, those two medicines are in the same class. And they work by moving the white blood cells into the lymph nodes. Not all of them, but most of them. And we know that in these clinical trials that people were at slight increased risk of having upper respiratory tract infections compared to placebo or other medicines when they took these medicines. These medicines don't work by killing white blood cells, but by taking them out of circulation. There's what I refer to as a functional immunosuppression. So there is a slight increased risk, I believe, for people taking Gilenya as compared to if they weren't on it at all, that they would have trouble fighting the infection. And that's a bit of conjecture because the reality is we don't actually know, but that's based on the mechanism of action and how we think the medicine works. Now, I'm going to say this once now, and I'll say it at the end, but the worst thing that I think that you could do is become nervous and just cold turkey stop your MS medicine. And in specific with Gilenya, as well as with Tysabri, there's a risk of a rebound phenomenon. So if you're taking Gilenya, the message is not stop taking it. No, the message is you're going to want to talk to your healthcare provider about whether the best course of action is to continue or to do something different. All right, and that's actually a really important point, Damian. We don't want people inappropriately stopping medicines out of fear because they might make their situation much, much worse.
Yeah, don't stop it all cold turkey because you scared of the back flu, you know?
That would be not so good for you. Now, to finish our conversation about pills, one of the newer pills to join the market is a medicine, cladribine, or the trade name in the United States is Mavenclad. And cladribine is an immunosuppressant. It reboots the immune response. You take a pill a day for 5 days, and then the next month you take 5 days, and then you don't do anything for a year, and then you repeat 5 days, wait a month, 5 days. Then you're good for the next several years. The way this medicine works is it suppresses the white blood cells, the B and the T cells, and lets them come back up. And so when you take this medicine, the risk for fighting infection has everything to do with timing. If you just took Mavenclad, you're going to suppress your immune response temporarily, and you're going to be at an increased risk of severe infection if you contract COVID-19. If you're looking 3 years past your last dose of Mavenclad, then you've reconstituted your immune response, and we don't think that you're going to be in harm's way. So the answer has everything to do with the timing. How long ago did you take Mavenclad, and how have your cells come back? Now, fortunately, with a very simple blood draw, we can check and we can look at your white blood cells. We can look at, again, your absolute lymphocyte count. And so we can guide you, yes, you're at increased risk. No, you're not at increased risk. So if you've taken Mavenclad, you can't untake it. All right. So once you set that in motion, it's set in motion. And that's okay. Knowing that you might be in a period of risk, we can take behaviors to help protect yourself. If you are just about ready to start Mavenclad, it's probably appropriate to talk to your local healthcare provider about your other risk factors, the geography of where you're living, how serious your MS is, and you're going to do a risk benefit about whether you pull the trigger or whether you delay starting therapy. And again, that's a conversation that you have to have with your healthcare provider. There are scenarios where the risk of contracting COVID might be low, and the risk of leaving your MS untreated is very high and concerning. And the better part of valor might be to take the pill, or the better part of valor might be to wait a month or two. And so that's a conversation that you're going to have with your healthcare provider. Now, we've talked about shots, we've talked about pills. I want to transition into infusions. And as it turns out, 3 of the most effective MS medicines on the market are all IV infusions taken through the vein.
Right. I'm on Ocrevus, and I know that's one of the big guns, and a big guns in the infusion category, and there are a couple others too. So please speak on that.
For certain. So of the 3 infusions, and I'm talking about Tysabri, which is the trade name for natalizumab, I'm talking about Ocrevus, the trade name for ocrelizumab, and alemtuzumab, that's Lemtrada. Of those 3 medicines, I think the lowest risk of the 3 is Tysabri. So Tysabri is a monthly infusion, and Tysabri makes the blood-brain barrier the Great Wall of China. All right, so it doesn't lower the peripheral immune response. It lowers the immune response in the brain.
Yeah.
So the periphery, the bloodstream, the lymph nodes, that part of your immune system is normal. And if you were to contract COVID-19, if you came in contact with it, your immune system would just beat it up. If, however, the virus got into the brain does not have normal immunosurveillance. It doesn't have a normal immune response, and that could be very serious. That being
Whoa.
said, that being said, I think that of the three infusions, Tysabri, quite frankly, might be the least concerning.
Mm.
And again, we do not want to cold turkey stop Tysabri because of a concern for a rebound phenomenon where the MS comes back with a vengeance. And so if you're taking Tysabri and you have concerns about COVID-19, you want to holler at your provider to discuss the region you live in, other risk factors, and whether the better part of valor is to keep on keeping on or if there needs to be a mitigating strategy. And that's going to be determined literally on a case-by-case basis for each person impacted by MS on Tysabri. Now,
Mm.
two more medicines that I want to discuss with you before we open it up to community questions. That
Mhm.
next medicine is Ocrevus, the medicine, Damian, that you said you're taking. And Ocrevus is an infusion in the vein twice a year. It works by knocking down a sliver of the immune response. So it's not a pan immunosuppressant. So it's not like napalm and you burn the place to the ground. It's selectively knocking out adult B cells. And that's
Mm.
relevant because when you need to fight a virus, you fight the virus with T cells. And ocrelizumab doesn't lower the T cells, it just lowers the B cells. And so if you're taking ocrelizumab, I do believe that you're at slight increased risk of having a more severe infection, but it may not be as bad as we would think with a classic immunosuppressant because we're only impacting the B cells. Now,
Mm.
Ocrevus is taken every 6 months, and there's a re-up. You take it 6 months later, you re-up. 6 months later, you take it again. And if you've been taking ocrelizumab and it's getting close to the time to redose, I think that's a conversation for your provider. Many people here in Ohio, I'm recommending they go ahead and take their medicine because we didn't put them on it casually. We put them on it to prevent MS from attacking their holiest of holies, the supercomputer, the brain. And we need that. But you can imagine in an area where there's higher concern geographically, or if a given individual has other risk factors, maybe comorbid conditions, or they're say in their 70s or something, you might delay the next infusion. Again, I think that's a critically important conversation that you have with your provider to figure out what makes the most sense for you. And
Mm.
really, you're going to be deciding, do we pull the trigger at 6 months or do we need to wait a month or two?
Mm.
You have signed up to start ocrelizumab, I really think it's the same conversation. Do we go ahead and start because the risk benefit favors treating the MS? Or, given that this is a mild form of immunosuppression, do we need to wait? Now, the last medicine that I want to discuss is arguably one of the most effective medicines. It's called Limtrada or alemtuzumab. And it works, again, it's an IV infusion, and it suppresses both the adult B and T cells. And it does that for a prolonged period of time. After you take Limtrada, it's going to take you the better part of a year to reconstitute your immune response.
Yeah.
And you take 5 days in a row, and then a year later, you take 3 days, and you're going to knock down your immune system again. And so when you're thinking about risk of severe infection with COVID-19, and as it relates to Limtrada, just like with cladribine, it's all about timing. If you had Limtrada 3 years ago and your absolute lymphocyte count has normalized, it's above zero point 0.8, I ain't worried because you've reconstituted your immune response. If you had Limtrada last week or last month or 6 months ago, or even within those first 2 years, you still might have a suppressed immune response. And so you may be at an increased risk category to have a severe infection if you contracted the virus. And so it's all about the timing. If you're someone that took the first dose and you're getting ready to take the second dose, I think that it's incumbent upon us to have a very serious conversation about, is this the right maneuver, or do we need to wait, or do we need to think about a different option? And in order to make that decision for the individual, we're going to have to weigh, what is their risk? Where do they work? Where do they travel? Do they have comorbid conditions, et cetera, et cetera? To be complete, Damian, we should also mention that stem cell transplantation, which is something that is done in the United States only in the context of research, but in other countries around the world is available. This is probably the highest category of risk.
Mm.
Ablating the immune response so that you don't have one puts you at the highest risk if you contract the infection. So I just want to kind of run through with you my thoughts or my opinions as it relates to risk of severe infection as in the disease modifying therapy.
I want to bullet this point where it's like, okay, if you have MS and it's dependent on your comorbidities and where you are located in the world, and yeah, what kind of medication you're it's taking. Also, this is risk. This is risk management. We're not saying that because you have MS, you're going to catch the disease, or
Yeah.
you have MS and you're on a certain disease modifying therapy, you're going to catch the disease. No one is saying that, and
You're
to
exactly
be
right.
worried about that, just try to temper that. I know it's a scary time, but there are plenty of other things to be worried about. And one of them, and the big thing, is managing risk. And you know
That's right.
about managing risk, and you've spoken about that. Please help us out with that. How do we
Well,
manage this risk when our immune systems are so tender, sir?
and that's the really the take home of this conversation, I hope, is that there are active things that we can do to lower our risk. To summarize what we just talked about, having MS doesn't lower your immune response. In fact, people with MS have an excessively exaggerated immune response. And so people with MS in and of itself aren't at increased risk of contracting the infection or having trouble fighting the infection. It's the medicines that you're on, the comorbid conditions, the other medical conditions, your age, and your geography that alter that risk profile. But let's get down to brass tacks and talk about things that you and I can do to manage the risk. And here's the take home. If you don't ever come in contact with COVID-19, you can't get COVID-19. It's kind of like saying, if you never come in contact with HIV tainted fluids, you can't get AIDS. If you don't come in contact with a person who is infected with COVID-19, you can't get the infection. And keeping that in mind, there are certain behaviors that we want to do. We want me to do them. We want you to do them because they will help the community. What are they? Number one, wash your hands. I mean, for real, we got to wash our hands. And there's two ways to wash hands. Way number one is to use a alcohol-based solution like Purell.
The hand sanitizer?
There you go. And you want the hand sanitizer to be at least 60% alcohol based. Now, let me share a pro tip with you. You can make hand sanitizer for real. If you buy isopropyl alcohol, yeah, for real. You can buy isopropyl alcohol, which is rubbing alcohol, and you can buy aloe vera, like the green aloe vera for like a sunburn, and you mix that together. That is hand sanitizer. So you could make hand sanitizer at home, quite frankly. And you want to sanitize your hands or wash your hands, and I'll get into washing in a second, at certain points. Number one, you want to wash your hands if you sneeze or cough. Number two, you want to wash your hands before you eat. Number three, you want to wash your hands after you go to the bathroom. These are important times to wash your hands using hand sanitizer, disinfectant, or washing with soap and water. Now, if you have dirt
hold on 1 second there. And when you sneeze, don't sneeze or try not to sneeze into your hand or your sleeve. You sneeze into
you want to sneeze. You want to sneeze into a tissue.
Deposit that tissue in the garbage and sanitize your hands.
I have a prop, Damian. I have a prop. So
okay.
I brought my own tissue as a prop.
Go get it.
If you're gonna sneeze or cough, do it into a Kleenex, and then take that Kleenex and throw that in the trash can. All right.
Done.
Then you need to wash your hands or use hand sanitizer afterwards. I don't want you to sneeze into your elbow because now you have virus on your sleeve, and someone could touch you.
And when you get tired and you're like, then you just put the virus in your eye, bro.
That's not a good idea. So if you're going to use soap and water, all right, then you need to wash your hands for 20 seconds. Now, 20 seconds is a really, really long time. And a lot of people, when they wash their hands, if you're in like a public bathroom, they'll get their hands wet, they'll put soap on their hands, and then they'll wash the soap off and they're good in the hood. No, they're not. You need to wash for 20 seconds. And so I want you to wash from the wrist up, and I want you to scrub the webs of your fingers. I want you to scrub your wrists. And a good way to make sure that you're washing with soap and water long enough is to sing a jingle, all right? So my son recently turned 13, and so let's together practice washing hands while we sing to my son Maxwell happy birthday. Are you with me? All right,
Sure.
ready? 1, 2, 3. Happy
Happy
birthday
birthday to you. Happy birthday to you. Happy birthday, dear Maxwell. Happy birthday to you.
and many more. So that's
More.
20 seconds. That's 20 seconds of washing hands, which brings up 2 points. One, I should never sing. All right.
Yeah,
Number two, 20 seconds is a long time. And if you don't
yeah,
want to sing happy birthday to my son, you could sing Twinkle Twinkle, or you could sing your favorite lyrics of something else, but it needs to be 20 seconds. All right.
yeah. I
So
sing
washing,
Eminem's "Lose Yourself" chorus. There's that Beyonce "Crazy Love."
fantastic.
There's "Raspberry Beret." I'm like, she wore a raspberry beret, the kind you find in a secondhand store.
That's
And
exactly
so on and
right. I
so
love it.
forth. So
Now, so
yeah,
that's the first thing is wash your hands. And I know that sounds like, advice grandma gave you, except grandma was right. All right. Because
right.
if you have virus on your hands and you sanitize your hands, then you're not going to infect yourself or somebody else. Tip number 2 is don't touch your face. Humans touch their face a couple times a minute on average. We're constantly touching our faces. And if you have virus on your hand and you touch the membrane of your eye, your nose, your mouth, that's how we're giving ourselves the virus. And so to the extent that you can, try not to monkey with your face. Try not to touch your face. And I bring that up to you because we do this without realizing it. If you watch the replay of this video, I guarantee that periodically I'm touching my face, you're touching your face. And so we just want to become more aware of it. We want to wash and sanitize, disinfect our hands, and we want to not touch our face. That's number 2. Number 3 is to wipe off surfaces that are commonly touched. So carrying some disinfectant wet wipes, like some baby wipes kind of thing, and wiping down the table before you eat, wiping down the area where you're going to be working, wiping down your phone, which is probably like a petri dish, because you're touching your face, you're dropping it on the floor, you're sticking it in your pocket. I mean, this thing probably has all kinds of germs on it.
It's great.
Wiping down the surface of your cane. These are things, and you don't need to be crazy. You don't need to go into a room and then clean the whole room. But simply wiping down commonly touched surfaces is a really, really good idea. Again, this COVID-19 virus can live on surfaces. And so we want to disinfect those surfaces with a wet wipe before we're touching them. And that's another way to decrease one's risk. We already talked about if you're going to sneeze or cough, do it into a tissue, throw the tissue out and wash your hands. That's an important one. And there's another really, really important tip. And so if you're not listening, start listening right now. You can socially distance. Let me explain what I'm talking about here. If you go in a crowd of 1,000 people and a couple people in that crowd have COVID-19 and they're coughing and they're sneezing, they're going to risk spreading that infection. All right. And in fact, we think that being within 6 feet of somebody with COVID-19, you can get the infection. So if you, on the other hand, remove yourself from that crowd, you socially isolate from that crowd, you can't get COVID-19. And so right now here in the state of Ohio, Ohio State University, which is a really big university, they have closed classes. Miami of Ohio, which is another university here in Ohio, they've closed classes for the semester. They're done for the semester. My kids who are in middle school, my kids are home from school for the next 3 weeks.
Good luck with that.
Yeah, thank you. The reason this is happening is because we're trying to minimize groups and crowds of people. I had plans to travel around the United States this month and next, going to Florida, going to California, going to the East Coast. I've actually canceled those plans. Not because I, Aaron, am concerned about contracting virus and being able to clear it, but I, Aaron, as a doctor in clinic, don't want to risk contracting the virus and then sharing it with all my patients.
Look at you, a responsible medical professional. I appreciate that. Thank you, Dr. Boster.
So you don't have to live in a hermit, all right? You don't have to board up your doors and hide. but you can make good decisions. Don't go to a concert, all right? I would not go to an amusement park, not right now. And if you have plans to travel, particularly in an airplane, and it's not required, I don't think now is the best time to do that. If you are someone impacted by MS and you're on one of these medicines which might place you at increased risk of getting a severe infection, you can mitigate that risk by avoiding contact, right? And so I think by making smart decisions, you can really up your game and keep yourself safe. And you can help prevent or slow down community transmission. If you've looked on the interwebs or at social media recently, there's a lot of hashtag flatten the curve, right? And what they're talking about is if you let virus just run rampant, it'll peak and then it'll slowly get better. All right, so that's what we saw in Wuhan before they knew what they were dealing with, right? We saw this massive peak, and now it's starting to come down. And the problem with that is that peak of infected people is so high, it overwhelmed their healthcare system. If we as a community can minimize the spread or slow the spread, we can keep the number of infected people that need healthcare professionals lower and flatten the curve so that it's more flat and it allows us to have adequate resources. So staying home when you're sick, avoiding sick contacts, sneezing into a tissue, washing your hands, disinfecting services, socially isolating, these are things that we can do not just to help us, not just to help our health, but to help our neighbor, to help our community. And they're things that we really, really should be doing right now. And so the last thing that I want to talk about after I have a sip of coffee is masks. Chin chin.
Right, man. I've been having the coffee this whole time, just sip by sip. But I haven't been saying this much because I'm not a medical professional. I'm just a nerd. I'm just a charismatic nerd.
Do go on. So let's talk about masks. If you have COVID-19, if you're infected, right, you've been tested and you're infected, and you need to go out of your house, wear a mask. I'm not asking you to wear a mask to protect you. That's not why someone who's sick with COVID-19 should wear a mask. They should wear a mask so they don't share the virus with other people. It's to protect other people from you coughing and sneezing and sharing the virus. If you do not have COVID-19, wearing a mask, particularly like the kind of mask that you pick up at the pharmacy, isn't going to help you. Those masks don't adequately protect you. And in fact, it might actually increase the risk of infection because the masks aren't professionally fitted and you're going to be touching your face and adjusting the mask on and off and adjusting the straps. And the result is you end up touching your face a lot more. Now, the other thing I want to point out is when a healthcare provider is wearing a mask, those N95 masks are special. They're not normal masks. You can't pick one up at the pharmacy, and they're fitted to your face. I remember when I was coming up through the ranks in medical training, about once a year, we'd have to go to this little room in the basement, and some dude is there, and he would fit us with the mask, and he'd fit it on our face, and then he would open up these chemicals and see if we could smell them through the mask. And if you could, then they would have to refit the mask. They even had to shave beards sometimes to get that bad boy to fit. And I want to share that because I think to not understand that, you could actually increase your risk by throwing on a faulty mask. So,
right, because the virus gets on the mask, and then you're touching the mask.
Exactly. Don't touch your face. So I appreciate, Damian, the opportunity to discuss COVID-19, what it is, what are the symptoms, who might be at increased risk as it relates to general risk factors, as it relates to MS risk factors. But most importantly, I really appreciate the opportunity to share with you things that you and I can do to keep us safe.
I appreciate how you have already on your channel and this channel worked to explain very plainly the risk factors involved and what someone with MS has to think about and be in their best health going forward. So I appreciate that. Thank you.
Right on.
We'll pause.
River Bear. River Bear. Come here.
That's my guy. Riverman, that's my guy right there.
All right, go lay down.
Hey, relax, bud. We're
All right.
trying to talk to the people, buddy. We're trying
All
to
right.
let them know right now. Can you sum it up one more time from the top? And just know that, folks, ask yourself these questions and just know that these are the answers that Dr. Boster is providing. And if you still have questions, talk to your healthcare professional. They know your own case better, or better than us. And they are on your team with you, ready to do the best thing for you. So run us through this one more time, sir.
So let's, from the top, very briefly. Having MS in and of itself does not increase the risk to contract the virus or fight the virus. If you have advanced MS and have trouble breathing or swallowing, you're at increased risk of having trouble clearing the virus. Means that if you contract it, it might be harder to fight it off. Similarly, if you are over the age of 60 or under the age of 9, if you have comorbid medical conditions, or if you're on a medicine that lowers your white blood cell count, you would have a higher risk of having a severe infection or a tougher time in fighting the infection. There are many, many things that you can do, that I can do, to decrease the exposure to the virus. Because if we can limit the community transmission of the virus, we can flatten the curve and we can get through this more safely. Those things include washing your hands or using hand sanitizer after you cough, after you sneeze, after you use the bathroom, before you eat. Sneezing or coughing into a Kleenex, throwing the Kleenex out, and then washing the hands. Making sure we wash hands with soap and water for 20 seconds. Maybe sing happy birthday to make sure that we're washing long enough. Not touching your face too much, because the way that we think that we're contracting the virus is by getting it on our hands and then touching our face. Wiping down surfaces with disinfectant wipes, commonly touched surfaces, and when appropriate, applying social isolation, taking ourselves out of the mix so that we can't come in contact with the virus. These are all things that we can do actively to lower our risk of contracting the virus. And if you have questions, call your healthcare provider, holler at us, because we want to help you.
Yeah, no, that's huge. And my video on my own YouTube channel was a mashup of yours and someone else's because they had the most clear, direct information for me to put together and be like, well, I wish there was something more, you guys, but the people that I trust say this, and wash your hands. So respect, and thank you for showing up today and being open and being open with your knowledge and your passion for folks with MS. Thank you, Doc.
It's my pleasure. You know, we are a community. This is a ever-growing global online community, and we are here to support each other. When I write hashtag stronger together, I mean it. And even if we are all in our individual houses, we have these interwebs to connect us. And that is a powerful, powerful tool. I want people that are watching this to know that you're not alone, all right? You're not doing this by yourself. And that we are here as a community to support you, and we love you. My name's Aaron Boster, and I want to thank you, as always, for learning about MS with me. Damian, MS Views News, I want to thank you for this opportunity. And until the next time that I do a live stream, or I see you on a video, or the next time I see you in clinic, this is Aaron Boster saying, be safe and take care.